Microblading. Prep. You will get much better results when you properly prep. It all starts with a good canvas. The eyebrow area must be healthy, strong, non-sensitive, and non-irritated. Here's how to get your skin ready for the procedure. Do not pick, tweeze, wax, perform electrolysis 1 week before the procedure. Do not tan 2 weeks prior to the service or have a sunburned face. Do not have any type of facial 2 weeks prior to the procedure. Do not work out the day of the procedure. Do not have BOTOX 3 weeks prior to the procedure. Do not take fish oil or vitamin E 1 week prior to the procedure. They are natural blood thinners. Do not wax or tint your eyebrows 3 days prior to the procedure. Do not drink alcohol 24 to 48 hours before your tattoo. Do not consume coffee before your procedure. Do not take an aspirin or ibuprofen for pain relief. These also thin the blood for 24 hours before your procedure. Aftercare. You are strongly advised to follow all post-microblading aftercare instructions to the T to allow your brows to heal properly, retain pigment, and prevent any bacterial infection. Microblading is an amazing form of semi-permanent makeup that has to be taken care of properly in order to get the desired results. Day 1. Gently blot the area 30 to 60 minutes after the procedure. Use a clean tissue or a cotton pad and a little bit of distilled or sterile water and antibacterial soap. Don't worry, this will not affect the pigment. Repeat this every 2 to 3 hours in order to avoid buildup of blood or lymph on the area. After wiping, apply a thin layer of tattoo goo ointment. Days 2 to 3. Carefully blot the area in the morning and in the evening. It is important to remove dead skin and bacteria. Make sure your hands are clean and use sterile or distilled water on a cotton pad or soft tissue. Do not rub, tug, or scrub the brows. After wiping, apply a thin layer of tattoo goo ointment. Your eyebrows must not look greasy, glossy, or shiny. If they do, you use too much. Also, when wiping the brows, don't make aggressive movements or manipulate the skin that way. It's highly important to be gentle. Days 4 to 14. Continue cleaning your face every morning and evening with water and gentle soap. Do not use products that contain acids and exfoliants. Only use gentle soap on your brows. Make sure to dry your brows by gently tapping a cotton pad or a soft tissue. Once you clean the eyebrow area, you may apply an extremely thin layer of ointment in a way you did it for the first couple days after the treatment. What to expect during certain stages. Days 3 to 5. Your eyebrows will start to scab. This is completely normal. Please do not pick at the scabs. Gently washing AM and PM will gradually allow scabs to fall off on their own. Removing scabs on your own will result in pigment loss and patchy results. Days 10 to 28. Your eyebrows can still be in their final stage of healing. Once all scabbing is gone, you may notice missing pigment and faded, disappeared hair strokes. Do not worry. This is normal. The pigment can take up to 4 weeks to resurface. Once your skin has exfoliated itself and the scabs have fallen off, you will now have baby skin on your eyebrows, and the pigment needs to now push itself up back towards the surface of the skin. All pigment will not return. At best, 80% of the pigment will retain after your first session. Results vary client to client. After the healing period is finished, you will need a touch-up. It is usually required 5 to 6 weeks after the initial procedure. You shouldn't ask for it before the 4-week period ends because the pigment color has not settled yet. Give your brows time to heal properly. Day of touch-up. We will go over your healing process and take a look at retention. Depending on retention, your touch-up should take 1 to 2 hours. This is the time for any adjustments to be made. Think shape and color. Avoid any face wash, liquids, or creams that contain acids, AHAs, BHAs, acne medication, or vitamin C. Think of your brows as baby skin. Yes, baby skin. Your eyebrows have just been cut and are trying to heal. You want to care for your eyebrows the same way you would any tattoo. Oily skin. Please use a small amount of provided tattoo goo ointment on your single-use Q-tips to apply only when the brows feel extremely stiff or itchy. Normal, dry skin. Please use a small amount of provided tattoo goo ointment on your single-use Q-tip to apply 1 to 2 times daily onto your brows. Your skin will need more moisture during the scabbing. Use at least twice daily. Things to avoid for at least 2 weeks post-microblading. Hot, steamy showers. Try limiting your showers to 5 minutes. When washing your hair, body, stand out of the direct water stream. Wearing any makeup on the eyebrow area. Sun exposure. Chlorine, salt water. Spray tanning, bed tanning. BOTOX, fillers. Waxing, threading. Moisturizer, creams, or liquids that contain any non-gentle agents. AHAs, BHAs, sulfur, salicylic, lactic, glycolic acids.